Now, Eric, I want to also just touch on the next scenario, which involves a patient who has had a previous blood clot in the leg, and they are also had been taking blood thinners but no longer. And there are lots of things that can cause some discomfort or swelling in the legs. And should these individuals also seek medical attention through the emergency department in the event they think they're having another blood clot?
Thanks, Jim. So this is another common scenario that we hear about very frequently. The challenge, as Jim described, is that if you've had a deep vein thrombosis previously and the swelling comes back, there are different reasons for why that can happen. So yes, it could be another deep vein thrombosis, but this could be something called post-thrombotic syndrome, wherein the chronic effects of the blood clot on the vein can lead to swelling and edema, which is fluid accumulation without actually signaling the recurrence of a blood clot. This could be infection. There's lots of different reasons for what could be happening here. My general advice in this situation would be not to ignore your symptoms, but in this situation, it may be advisable to reach out to your primary healthcare provider first. And instead of going straight to the emergency room, unless it's very clear that the pain and swelling are out of proportion and very, very worrisome. Usually, if you can speak with the primary care provider, they will usually be able to give you advice on whether you need to be seen in person in their own clinic or if you should go straight to the emergency room. The other thing to keep in mind, unlike pulmonary embolism, there are ways of diagnosing DVT outside hospital. For example, often there are community medical imaging laboratories where you can get vascular or Doppler ultrasound testing done to rule in or rule out DVT. And this may, although we did discuss that the emergency room is certainly a safe place to go, this may help to establish a diagnosis or rule out recurrence of DVT and allow this to be managed on an outpatient basis. As a caveat to that, the other thing I'll mention is, even though you are seeing, you may not be seen in hospital directly, there are ways of establishing diagnosis. And in some cases, as a hematologist, we do speak with our primary care providers as well and provide them advice as well. And so, I think this is a slightly different scenario than pulmonary embolism.
Thank you very much, Dr. Tseng.